Good morning, Mr. Monkey. My name is Heather. I'm going to be your nurse for today. Can you go ahead and state your name and date of birth for me, please? Okay, great. So tell me more about these symptoms that you've been having in your abdomen. Okay. I'm sorry to hear that. So do you know if you have a family history of gastroesophageal reflux disease, peptic ulcer disease, or irritable bowel syndrome? Okay, so tell me more about these symptoms. Do you have any nausea, vomiting, diarrhea? Okay, how's your appetite been? Have you been eating regularly? All right. When was the last time that you had a bowel movement? Okay, great. Any changes in your diet recently? No? All right. Also, I heard that you've been having a little bit of pain in your stomach. Can you describe that pain to me? Okay, where is it exactly? What's the location? How bad would you say that it is on a scale of 0 to 10? Do you find that anything makes it better or worse? All right. So next I'm going to take a look at your abdomen. So the first thing you want to do is inspect the patient's abdomen. So we're looking at the size, shape, symmetry, the color of the abdomen. You want to look, see if there's any pulsations. Sometimes you can even visibly see a mass. You also want to look for any striae, any scarring on the patient's stomach. Then you want to take a look at their umbilicus. So you're just looking at the location of that, making sure that it's nice and midline. And you can also check the contour of that as well. So next we want to listen to the abdomen. So for this, we're going to start in the right lower quadrant. And you should hear a vowel sound every 5 to 15 seconds. Okay, so we make sure that we listen in all 4 quadrants. And if we're not hearing any vowel sounds in all 4 quadrants, we need to listen to the patient's abdomen for a full 5 minutes before saying that they have no vowel sounds. So after that, we're going to use the bell of our stethoscope to listen for any bruits. So the first place that we're going to check is going to be the aorta. I'm going to listen to that. Then down to the renal arteries, checking always bilaterally on both sides. Second renal artery. Then we go down to the iliac artery. And last but not least, the femoral arteries. So the bruit sounds, they're going to be like a swishing sound, and it can indicate constriction or dilation of the artery. So you want to report those to the doctor if you hear any of that. After that, then we can go ahead and percuss. So just little percussion over the abdomen. The stomach is going to sound more hollow, whereas solid organs are going to have more of a dull sound to them. So after that, we can go ahead and do palpation of the stomach. So you can do that in the same motion that you were doing auscultation, kind of going from each quadrant to the other. So you want to check your patient, see if they're guarding, grimacing, or any of that. You also want to make sure that the stomach's not distended at all, and make sure that it's non-tender. You want that stomach to be nice and soft. Just checking for pain, any masses, and assessing your patient's overall status to make sure that they're okay. And other than that, that's it for the abdominal assessment.